U.S. Ambassador Philip Kosnet announced recently 1.1 million in assistance to Kosovo in the fight against COVID-19. What exactly is that assistance?
So yes, we indeed are providing 1.1 million support specifically to Kosovo, and that support will be focused on operational support and also increasing the response capability of Kosovo so that we can help the communities here to stop further transmission and mitigate the impact of COVID-19. I think one good thing that the data is showing us about Kosovo is the majority, if not all of the cases, are from known contacts. There has been no community transmission in Kosovo, which is why following the preventive measures as well by citizens and communities in Kosovo will go a long way in mitigating the impact of COVID-19.
To whom is this assistance intended? Are they Kosovo health institutions?
Well, the assistance is intended for all people of Kosovo. We are working with established partners who are experts in responding to this kind of crisis, particularly the World Health Organization, the in-country office of WHO, as well as UNICEF, which also has offices here. So with those agencies plus the UN Kosovo team, USAID is working with them very closely. We are coordinating with the Ministry of Health, particularly as we start the actual operations in communities.
Will this assistance also reach Serbian hospitals operating in poor conditions? Gračanica Hospitals has only 2 respirators and other medical equipment and medicines are missing.
So part of the assistance is actually directed towards families because with UNICEF, the assistance we're talking about right now is expanding the distribution of the family hygiene kits because it's very important at the family and community level that people have the armor that they need to help fight against COVID-19. And as agreed with UNICEF and also arrangements with the Ministry of Health, that is going to all communities, be they Kosovo Albanian communities or Kosovo Serb communities. Now, as to your question about equipment, and both USAID and WHO are extremely aware that the Gračanica clinic is quite short on, shall we say, on equipment. So we are working on how we can specifically help the Gračanica clinic as well as other facilities that are better able to reach out to the Kosovo Serb communities. Part of the issue right now that we're working on is, as you are aware, it's very hard to get the kind of equipment that's needed because the whole world is buying that equipment, and then with the disruptions in in transport, shipment of any supplies and equipment is also problematic. But all I can say right now is we're definitely working on this. We are quite aware that the Gračanica clinic is one that is very critical, and we want to make sure that both the Pristina testing, Pristina Diagnostic Laboratory, as well as other facilities which serve the Kosovo Serb communities, are able to improve their testing capacities.
So far, a lot of international assistance has arrived in Kosovo, and very little of that assistance has come to Serb-populated areas. How do you look at this attitude and the international community towards one part of the population?
So I think that's a good message for us to improve our actual implementation. I know UNICEF received several tons of supplies from their own resources. I think last Monday. So we will definitely work with the relevant institutions to make sure that the distribution is much more efficient. The intent I would underline is really to make sure that whatever assistance is available, it's provided to all communities. And I think, if I may, I'll also reference the press conference that the Minister for Return and Communities, Dalibor Yeftic, and the Acting Minister of Health, Vitia, did last Friday, where the message clearly was the assistance, whether it's from the government, from the international community, and working with MOH, we will definitely want to make sure that this assistance goes to all communities.
What are USAID activities nowadays?
We continue with our activities, and actually, maybe it might be good to mention, particularly for Gracanica, we have chosen Gracanica as a pilot community for one of our ongoing projects, which is around economic governance, and specifically, we are helping the municipality as well as the citizens streamline the construction permitting process. So look forward to more outreach activities on this activity. And one area also that's noteworthy is in agriculture, especially with the medicinal and aromatic plants. We are doing a lot of work with Kosovo Serb communities and facilitating trade and economic opportunities between the farmers of medicinal and aromatic plants and the distributors and exporters of those plants. If I may, Zorika, I have one more thing I want to mention, because I really want to give a shout out to the people in the communities. So, for example, I know that the Gracanica Innovation Center, which we have had the fortune to be associated with, I know that they've been making visors, for example, and actually made donations to the Gracanica Hospital. So it's very good that communities and organizations at at the municipal level are also contributing. And I know that when the GIC ran out of raw materials, Formon, which is a Pristina-based entity, actually donated filament so they can continue their production and help the Gracanica clinics, while GIC placed an order with Giraffa, and I think that shipment will take a few days. So Formon had to step in. Similarly, I also want to give a shout out to the young active Gracanica, because I know that they came up with an idea to, through the bicycles that they use in their tourism project, to help shoppers and sellers, again, to minimize contact and just help distribute, foodstuffs to the members of the community in Gracanica. So I wanted to make sure I mentioned that, because it's not just up to the international community, and it's really very heartwarming and very encouraging when we also hear of community initiatives, because, we're all in this together.
Thank you very much, Mrs. Magno, for this interview.